Welcome to the second special invited lecture of the 34th AGM and Conference of the Pakistan Society of Development Economists. The theme of this session is the economics of addiction. The lecture, which is titled The Economics of Addiction and delivered by Professor Frank Chaloupka, will be followed by the launch of two reports on tobacco use, consumption, its macroeconomic impact, and taxation in Pakistan. The first report, prepared by researchers at the Social Policy and Development Center, Karachi, is titled The Macroeconomic Impacts of Tobacco Use in Pakistan. The second report, The Economics of Tobacco Taxation and Consumption in Pakistan, has been prepared by researchers at the Pakistan Institute of Development Economics, Islamabad. Now I request the chairperson of this session, Major General Dr. Azhar Mahmood Kiani, to please come on stage. The speaker for this session is Professor Frank Chaloupka, who is already on the stage, and the two discussants are Dr. Roberto Iglesias and Dr. Muhammad Idris. The chair of this session, Major General Dr. Azhar Mahmood Kiani, is currently the Executive Director, Rawalpindi Institute of Cardiology. He is also the President of the Pakistan Cardiac Society and a Senior Consultant for Interventional Cardiology at the Armed Forces Institute for Cardiology, Rawalpindi. Dr. Kiani has 36 years of clinical experience and also has over 20 publications to his credit. He is a graduate of the prestigious King Edward Medical College, Lahore, and is a member of the Royal College of Physicians and Surgeons, London. The speaker, Professor Frank Chaloupka, is a research professor in the Division of Health Policy and Administration at the Chicago School of Public Health, University of Illinois, Chicago. He is also associated with the National Bureau of Economic Research Health Economics Program and Program on Children. Professor Chaloupka is an expert in the economic analysis of substance abuse, use and abuse, and the effect of prices and substance control policies in affecting the demands for tobacco, alcohol, and illicit drugs. He is also a recipient of the World Health Organization 2014 No Tobacco Day Award. Professor Chaloupka has over 150 publications on the economics of drug prevention, tobacco control, and related topics. He holds a PhD in economics from the City University of New York. Our first discussion of the lecture, Dr. Roberto Iglesias, is currently Technical Officer, Prevention of Non-Communicable Diseases, the World Health Organization. He has also served as the Deputy Secretary of Economic Policy in the Ministry of Finance, Brazil. In addition, he has taught at the Pontifical Catholic University of Rio de Janeiro. Dr. Iglesias has published numerous papers on tobacco control and taxes on cigarettes and other topics. He has a doctorate in economics from the University of Oxford. The second discussant, Dr. Muhammad Idris, is an associate professor of economics and director, School of Economics, Quaid-e-Azam University, Islamabad. His research interests are in consumer behavior, poverty, income distribution, and social sector. He has more than 20 publications to his credit, and he has a PhD from Quaid-e-Azam University, Islamabad. Now I hand over the proceedings to the chair, Dr. Kiani.
Well, thank you very much. I think what kind of role I'd need to play is whether I would be a moderator or I would be controlling this session. I don't know. As far as I'm concerned, I'm a professional, I'm a cardiologist. I know smoking is one of the #1 killer throughout the world, and it's #1 cause of death in cardiovascular diseases. And 80% of the lung cancers are because of smoking. And whatever the topic is here today, I think it's a very, very interesting topic. In Pakistan, you know that this part of the world, you have small diameter of the arteries, and here the disease comes 10 to 15 years earlier than the rest of the ethnic population. People here, they have a heart attack 10 to 15 years before the other population. And once they have the heart attack, it's deadly. More mortality, more complications. And the best way, I think, to have a good health is that you, #1, quit smoking, then have a healthy diet and exercise as much as you can. More of exercise and less of eating. That's the solution as far as the cardiovascular disease in Pakistan is concerned. So let's begin, I think, with the first speaker. And you're going to the one? Yeah, please, go ahead.
Thank you for the very kind introduction. My name is Frank Chaloupka. I come from the University of Illinois in Chicago. And I'm going to spend the next 40 or so minutes talking about the economics of addiction, work that I've been doing over the last several decades. Okay, so I'm going to cover a variety of different things over the next 40 minutes. I'm going to talk about some of the work that I've been doing for over 30 years looking at the economics of addiction, talk about some of the economic models of addictive behaviors and how those have evolved over time, and then spend a fair amount of time talking about the evidence that we have on the impact of taxes and prices on things like tobacco use and other unhealthy behaviors. Talk briefly about some of the other economic issues that relate to addiction, some of the obstacles or the barriers to adopting effective policies like tax policy that we just heard about. And then briefly introduce some of the ongoing activities that we have here in Pakistan as well as around the world, and talk a bit about some of the work that's going to be discussed tomorrow. So just starting with the basic economics of addiction. Economists started to look at economic behavior, consumer behavior, when it came to demand for things like tobacco and alcohol several decades ago. But when they first started doing that, they did that in the context of traditional demand models, models that basically looked at consumption as a function of price, income, and various other factors, but didn't really fully capture the things that differentiate addictive goods from consumption of other products. And there's really three basic factors that distinguish addictive behaviors. One is the idea of tolerance, that as somebody consumes more of an addictive substance, they need to consume more to get the same effects relative to what they consumed in the past. The second idea is the idea of reinforcement, and that's the idea that consumers learn how to use these products in a way that really provides additional rewards from the consumption of those. They learn to use them in certain situations when they're going to provide more of an impact. And then the last idea is the one of withdrawal, and that's that if somebody stops consuming the addictive product, that's going to lead to a loss of utility, a negative physical reaction as a result of that cessation of consumption. Over time, what started to happen was economists realized that addictive behaviors were different than other behaviors and tried to account for at least the intertemporal dependence of consumption, the idea that your consumption decision now depends on how much you consumed in the past. And the first round of advances here was what we called myopic addiction models, that in addition to looking at consumption as a function of current factors, also looked at how it was influenced by past behavior. And the past behavior was generally reflected through what we called a stock of addictive goods, which reflected how much people had consumed over time in the past. And then I think the real advance was when we started to think about more traditional economic models that accounted for forward-looking behavior. So I was fortunate to be involved in my PhD work at the same time as the economic models of addiction, the rational addiction model in particular, were really starting to be developed. And the real innovation from the rational addiction model is that it didn't just look backwards. It didn't just take account of those past influences on consumption, but it took account of the fact that people would also respond to changes in some of the future costs of addiction. So as new information, for example, about the health consequences of something like smoking would come out, people would incorporate that into their decision making. They would respond to that and change their behaviors in response. These were a significant advance, but they were also much more challenging to implement empirically. The nice thing about these models, though, is that they really come up with a variety of policy-relevant, empirically testable predictions. Some of the predictions relate to time preference and how that influences how different populations are going to respond to policy and other changes. For example, one key prediction that comes out of these models is that people with low rates of time preference, generally younger people, people that are less educated, are going to respond more to changes in the immediate costs of an addictive product. So if you raise taxes, if you raise prices on something like cigarettes, that's going to lead to a bigger response among young people and among lower SES populations. In contrast, people with higher rates of time preference, people that are more forward-looking, are going to respond more to the long-term consequences, information about the health consequences, for example. We also talked about the difference between permanent price changes and temporary price changes, and the idea that a permanent price change is going to have a much bigger, longer-lasting impact. Same thing is going to be true in terms of anticipated versus unanticipated price changes. If people know the price change is coming, they're going to start to adapt before the price increase actually goes into effect. And then the last part is that because of the addictive nature the response to price is going to grow over time, and we'll see longer run, larger impacts than what we see in the immediate short run. So again, I was in the process of doing my PhD dissertation at the time that these models were being developed, and was able to provide the first empirical application of the rational addiction model. And I did that to cigarette smoking in the US. We had very good data on cigarette consumption. We had very good information on prices. We had a lot of variation in prices across the US because of differences in taxes across states. And we also had a lot of variation in prices over time. So it gave me the empirical power to really be able to start to look at how price affected behavior in the context of this rational addiction model. And what I found was that's very consistent with the theory. We saw that the long-run price effects were substantial, price elasticities of almost 0.5 at the high end. We saw that the estimates that we were getting for long-run elasticity were about double what I was getting for the short run. And then consistent with some of those hypotheses around time preference, we saw that young populations, less educated populations, were particularly responsive to price. Now, the rational addiction model came with a lot of criticisms. There were a lot of economists that didn't think that this was a good application of economic theory. The first economics conference that I ever presented my dissertation work at, I was told that this wasn't economics, that I should be doing something else. And you can see some of the criticisms reflected in this quote from a paper that came out in the early 80s, talking about the idea that the whole concept of rational addiction didn't make sense, that the idea that people were going to make this planning process where they would become addicted and then be happy being addicted. But what was really true is that I think people overinterpreted the idea of rationality. People thought that this was some situation where there was perfect foresight, where people fully understood all the future consequences of what they were doing, and that then they would make this decision to become addicted. And that's where the modeling started to go from there, is really to take account of some of these concerns about the concept of perfect rationality. Really starting to build in uncertainty about things like future costs, the future health consequences, taking account of the fact that when people are initiating these behaviors, they don't really fully understand addiction, and as a result, they end up in a behavior that they come to regret. And then some of the more recent advances have come up with the idea of time-inconsistent preferences, the idea that somebody basically behaves like two people. In the short run, they're maximizing their satisfaction from consumption of the addictive good, despite knowing in the long run it's going to be harmful and wishing that they could quit. In addition to tobacco, then, we moved on from applying it to other products. I started looking at the demand for alcoholic beverages, looking at the demand for various illicit drugs, and finding, again, very consistent evidence that price mattered when it came to the demand for these products, that long-run price elasticities were larger than short-run price elasticities, that key populations, young people in particular, were much more sensitive to price. And then one of the interesting things that comes out of this is that one way to measure how addictive something is in the context of these models is to look at how much of a difference there is between the long-run price effects and the short-run price effects. The bigger the difference between the two, the more addictive the behavior was. And the estimates that we were getting suggested that cigarettes actually were the most addictive product that we were looking at, the most addictive product that we studied. Illicit drugs fell somewhere in between. We did a lot of work on cocaine demand. And then alcohol, for most people, is actually not very addictive. And not surprisingly, we saw the least evidence of addiction there. The other advance that we made during this time was to really start to expand the concept of price beyond just monetary prices into a concept I call full price. And the idea here is that we're looking at not just the money costs, but also all the other costs that go along with consumption. And when it comes to a lot of these addictive or unhealthy products, what we're thinking about are things like legal costs. When you think about illicit drugs, you can think about some of the costs associated with using those. The health consequences, the long-term health consequences, and people's understandings of those. We started to try to incorporate ideas of social norms and social disapproval for these types of products as one of the costs. Looked at time costs and various other costs, and I'll talk just briefly about some of those. So again, what I've been doing is in this area, working on this for almost over 30 years, doing a lot of work on tobacco, alcohol demand, other health behaviors that I'll talk briefly about, and just going to review the evidence fairly quickly on these. Whenever I talk about this, I always like to talk about this, or always use this quote from Adam Smith. This is my all-time favorite quote in my dissertation and almost everything I've done since. Talking about sugar, rum, and tobacco, commodities which are nowhere necessaries of life. which have become objects of almost universal consumption and which are therefore extremely proper subjects of taxation. So again, there's been a lot of work on tobacco use over the years. We've seen hundreds of studies now on the economics of tobacco taxation, tobacco pricing, other aspects of tobacco control. A lot of that's summarized in a monograph that we recently produced with the U.S. National Cancer Institute and with the World Health Organization. That monograph 21 on the bottom there on the economics of tobacco and tobacco control. What we know is the evidence is clear. When we look at the impact of prices on the demand for tobacco products, in high-income countries, we have good evidence that price elasticity is around minus 0.4, 10% increase in price, about a 4% reduction in consumption. We see more variability in the estimates across low and middle-income countries. In general, most price elasticity estimates fall in the range from minus 0.2 to minus 0.8, with most of the estimates clustering around 0.5. We know that about half of the impact of tax and price on tobacco use comes through reductions in the number of people who consume the product. So we're talking about prevalence elasticities of around minus 0.2 or minus 0.25 on average around countries. And most of the changes that we see in prevalence are coming from changes in current smokers' behaviors. We've done a lot of work trying to look at quitting behavior and how that responds to price. And these are some data from the US, just looking at calls to quit lines, which is a good indicator of smokers' interest in quitting. And what we see is when taxes and prices go up, we see significant interest in quitting. Our estimates suggest that for every 10% increase in price, about 10% of smokers are going to quit. And then the interesting thing, consistent with those rational addiction models, is that people start to try to quit smoking even before the price increases go into effect. So the big spike in calls to the quit lines in the US last happened around our last big national tax increase. And you can see in the months leading up to that tax increase, as it was announced, smokers started to try to quit because they knew those increases in prices were coming. The other thing we've learned is that, again, because it's a very addictive behavior, many of the smokers who try to quit aren't going to succeed in doing that. Our estimates suggest that about 1 in 5 smokers who tries to quit in response to that price increase is actually going to be effective in doing that. These are some data from the US that just illustrates that, showing that in states that have high taxes and prices, we see many more former smokers, many more smokers who have successfully quit smoking relative to what we see in states that have lower taxes and lower prices. Again, I've done a lot of work trying to look at young people's decisions to use tobacco products, and price is a significant driver here. Our estimates suggest that kids are 2 to 3 times more sensitive to price when it comes to their tobacco use. And a lot of that has to do with the fact that they're less addicted, they're more present-oriented, they're going to respond more to changes in current costs, and then they're also much more influenced by what their peers are doing. Some of the work that we've done on peer influences, for example, suggests that that accounts for about 1/3 of the impact of price on kids. As you change some kids' behavior, because their peers' behavior is changing, that's going to lead to changes in their own behaviors. One of the things that we've been doing most recently is trying to understand how tax and price levels affect the price elasticity of demand for tobacco products. And what we're able to do in the US is take advantage of the fact that we have very different taxes and prices across states. We've seen very large increases in some places over time, very little change in others. And what we're learning is that the demand for cigarettes is becoming more responsive to price, less inelastic as prices are going up. So what we see here is on average at the high end, if prices are about double the average, we're finding that the elasticity is about double as well. And we're seeing that both in aggregate sales data as well as in some of the individual behavior data. The other thing that we've learned in working in low and middle income countries is that it's not just price by itself that really matters, it's how price is changing relative to incomes, or a concept that we call affordability. So as cigarettes become less affordable, that's going to lead to changes in demand in these countries. And as cigarettes become more affordable, the opposite's going to happen. We're going to see big increases in use. So I think that's really well illustrated by this picture from Bangladesh. If you go back to the late 1990s, cigarettes were becoming less affordable in Bangladesh. Cigarette demand was going down, but then income started to grow very rapidly. Tax and price increases didn't keep up. Cigarettes became more affordable, and what we started to see was increases in tobacco use, increases in smoking in Bangladesh. We spent a lot of our time recently trying to understand not just cigarette demand, but also looking at the demand for other tobacco products. And we're seeing very consistent evidence for these products as well. Generally finding higher price elasticities for other tobacco products besides cigarettes. And then seeing a lot of evidence of substitution between comparable products. So if you think about combustible tobacco products, things like roll your own tobacco, little cigars, and other things like that, we see a lot of substitution with cigarettes as the relative price of cigarettes goes up, but the prices of these other products don't go up as fast. And then interestingly, at least in the US, we're seeing some evidence of complementarity between non-combustible products and combustible products. And I think that's partly a response to people being able to maintain their addictions by using these non-combustible products in environments where they're not able to smoke tobacco. And then in the end, what we're seeing is also significant evidence of the impact of tax and price on the health consequences of tobacco use. So I've had a few students recently do dissertations looking at things like morbidity and mortality rates associated with the diseases that are caused by tobacco. And what they're finding is very consistent with this picture from France. This is just illustrating, as prices have gone up there, as taxes have gone up there, on the blue line, you can see on the red line, consumption comes down very quickly for cigarettes. And then within a few years, we start to see some of the health benefits showing up in terms of reductions in lung cancer death rates. The other thing we know is because demand is inelastic and because taxes account for only a share of price, we also know that when taxes on these products go up, we're going to see significant increases in the revenues that are generated from those taxes. So this is a picture from Ukraine. Ukraine has increased their taxes significantly, about tenfold over the last 10 years. And as they've significantly reduced tobacco use, they've also seen big increases, a six-fold increase in cigarette tax revenues. So that led us in the monograph to this conclusion. We reviewed the hundreds of studies from around the world and basically came to the conclusion that significant increases in taxes and prices are the most effective way to reduce overall tobacco use. The other thing that we've been doing is really starting to look at the demand for emerging tobacco products. So we've seen things like vaping products, e-cigarettes and other vaping products emerge in a number of countries. We're starting to see heated tobacco products showing up in various parts of the world. And we're seeing evidence very consistent with what we saw for cigarettes. The demand for these products is sensitive to price. If anything, it's 3 times or more sensitive to price than what we see for cigarette demand. And we're starting to think about, given the evidence on the health consequences of combustible tobacco product use relative to these new products, starting to think about what some of the implications are for taxation of these products. And one of the ideas that I've been talking about as a result of the work that we've done is the concept of differential taxation, or taxation of different nicotine products relative to the risks that are caused by those products. So the idea is you want to tax these emerging products at a high enough level to discourage kids from using them. You want to raise the taxes on the more harmful cigarettes and other combustible products in a way to discourage all use of those products. And then for the most addicted consumers who aren't able to quit, the idea is you maintain some price differential so that they switch from the more harmful products to the less harmful products and reduce the overall public health harms from tobacco use. We've been doing the same sort of work on alcohol use and are seeing the same sort of evidence from around the world. It's not quite as well developed as the literature we have for tobacco. With tobacco, hundreds of studies, many from low and middle income countries. With alcohol, we have a good literature from high income countries, but only a handful of studies from low and middle income countries at this point. But again, the results here are very consistent. We're finding consistent evidence that tax and price increases are effective in reducing the use of alcohol. The estimates for elasticity in high income countries are right around 0.6 on average. And very similar estimates in the few studies that come from low and middle income countries. And then we also see evidence that all aspects of drinking are affected by price. We look at the prevalence of drinking. We look at how much people consume when they consume, things like binge drinking. And we've been looking at the frequency of drinking. And again, very consistent with what we see from tobacco, we see that younger populations are relatively responsive to these tax and price changes. Just a couple of pictures to illustrate that. This is some data from Ukraine, where Ukraine had seen prices falling in real terms over time for distilled spirits. They started to raise taxes in the early 2000s. And what we've seen is that as tax and price have gone up, we've seen significant reductions in distilled spirits consumptions in Ukraine. Some of the work that we've done in the US looks at, again, the variations that we see across states in taxes and prices, and how that relates to things like binge drinking, drinking many drinks, 5 drinks or more on a single occasion. And we see significant evidence, again, states with high tax, high price have less binge drinking. States with lower taxes and lower prices have more binge drinking. And then being economists, we've looked at every other outcome that we can think of that relates to alcohol use and excessive alcohol use. We've done a lot of work on drinking and driving behaviors, people's engagement in drinking and driving, getting into accidents and traffic fatalities caused by drinking and driving. Very consistent evidence, again, that drinking and driving responds to tax and price increases. We've done a lot of work on the long-term consequences. We've looked at things like liver cirrhosis, which is a good indicator of alcohol addiction. Looked at cardiovascular disease deaths, cancer deaths, and various other deaths attributable to excessive alcohol use. Again, consistent evidence, higher prices, reductions in deaths, lower prices, more deaths from these consequences. And then we've also looked at things like violence, homicides, and suicides, and workplace accidents, and sexually transmitted disease rates. And again, very consistent evidence. As tax and price changes, we see significant changes in these outcomes, these consequences of alcohol use. And same story, these are very effective given the elasticities that I talked about, given the relatively low shares of tax and price for alcohol. As tax and price go up, we see significant increases in revenues. And in the US, we haven't raised our taxes very often, as this graph illustrates. And because we haven't raised taxes very often, the revenues that have been generated have been eroded by inflation over time. All right, so I've also done a fair amount of work going back almost 30 years on the demand for illicit drugs and looking at how prices affect these behaviors. And again, we see very consistent evidence here. These behaviors also respond to price. I think there's a lot of perception that because something was addictive, people wouldn't respond to changes in price. They would change their behaviors in other ways to maintain consumption. But we've seen that things like cocaine use, heroin use, marijuana use are responsive to price. Differing responsiveness across different products, but generally consistent evidence that higher prices reduce use, lower prices increase use. And tending to find evidence of complementarity across substances. So that things like cigarette use is also associated with more marijuana use. If we've done some work looking to show that if cigarette prices go up, we see reductions not just in youth cigarette smoking, but we also see reductions in things like youth marijuana use. And then when it comes to the whole concept of full price, really quickly here, we've done work trying to look at all the different control policies that governments use to try to deal with these addictive behaviors. When it comes to tobacco use, for example, we've looked at things like smoke-free policies, which really create an inconvenience cost for smokers. They have to go outside to smoke. They can't smoke indoors. We've looked at things like graphic health warnings, which raise the expected health costs associated with tobacco use. Mass media campaigns, marketing bans, things like that. And again, very consistent evidence that as we raise the full price of tobacco use, as we impose these types of policies, we see reductions in tobacco use among young people and among adults. Very much the same sort of evidence when it comes to things like alcohol control policies. Increasing the penalties for drinking and driving, strengthening enforcement, raising the perceptions of legal costs are going to be very effective in reducing things like drinking and driving and binge drinking. We see reductions in physical availability through controls on outlet density. Again, raising time costs, very effective in reducing the use of these products and the consequences associated with them. And then some of the interesting work, or things that I'm finding most interesting these days, are looking at what's happening with illicit drug use. There's been a lot of changes in the US over the last 40 or so years in policies addressing marijuana. It really started in the 1970s with the decriminalization of marijuana, reducing the penalties, making it a relatively minor offense in many states. We saw a lot of evidence showing that the decriminalization contributed to increases in youth marijuana use, adult marijuana use. We've looked at the same sorts of things when it comes to penalties for other drug use across states. And again, generally see evidence consistent with the idea that increases in these penalties are effective in reducing use. We started to do some work in the early 2000s as states began to medicalize marijuana, allow for the medical use of marijuana to look at how that impacted on use. And here we were seeing some evidence that these policies were leading to increases in marijuana use among young people. And that was particularly true in the states that had the most liberal policies, states where they allowed for things like home cultivation, which is going to, I think, increase the access to the product. So we've seen that sort of thing happening. And right now we have a very interesting natural experiment going on in the US and starting to happen in other countries where we're seeing states legalizing the recreational use of marijuana. So I'm currently living in Colorado. Colorado was the first state in the US to legalize. And I find this one a fascinating picture. There's more places that you can buy marijuana in Denver than there are Starbucks and McDonald's combined, which are ubiquitous, I think, in most places. So we're starting to think about how these changes affect the use of marijuana. The other thing we're seeing is that there's a whole proliferation of products that incorporate marijuana. So it's not just the smoked marijuana anymore. There's a whole variety of edibles. It's in pretty much everything that you can think of. It's in sodas, it's in candies, it's in pasta sauces, it's in almost every different product that you can think of. And there are very few constraints on use at this point, very few constraints on things like marketing. And the public health campaigns around it are not very powerful. So you can think about that billboard on the bottom, which makes it look like it's a celebration. When you turn 21, now you're going to be able to buy marijuana legally in Colorado. So not talking about the sort of the health consequences that we've seen in the public health campaigns against things like tobacco or drinking and driving. And then you start to get the intersection of this with some of the tobacco control policies. So a lot of the new vaping products that have emerged for using tobacco products are also becoming very popular when it comes to using marijuana. To have a liquid with the THC in it, that people can use these almost completely without being detected in almost any situation, any environment. So we're doing some work. I'm just dabbling in this area. I have some good colleagues at the RAND Corporation in the US that are doing some good work on this, looking at what the implications of these changes in policy are for marijuana use and some of the consequences of that in the US. All right, the last thing that I'm going to talk about here is the idea that these policies can also be used effectively to deal with some of the other emerging health consequences, big contributors to non-communicable diseases around the world. So the work that we had done on tobacco, alcohol use, drug use, we started to think about what the implications would be for the rapid rise in obesity that we saw in the US and in a lot of other countries around the world. And started looking at the demand for foods and beverages. There's not surprisingly a big economics literature that shows that the demand for foods and beverages is responsive to price. We've been focusing in on some of the more unhealthy products or healthier options, looking at things like sugar-sweetened beverage consumption, fast food consumption, and then contrasting that with things like fruit and vegetable consumption. And here we see good evidence, again, that some of the demands for these products are very responsive to price. Things like sugar-sweetened beverage consumption in particular. And again, if you just look at the data from around the world, you see very consistent evidence of that. This is some simple work looking at the demand for sweets and savory snacks. We estimate an elasticity of about 0.55 for these products, so higher prices there, reductions in consumption. And then for sugary beverages, we see even bigger impacts, more elastic demand for these products. The next step has been more complicated, and that's to try to take the changes in the prices of these products and link them to changes in weight outcomes. We've been doing some good work here, my colleague Lisa Powell in particular, looking at longitudinal data to understand changes in weight over time and how that relates to consumption patterns and ultimately to relative prices. And I think we're starting to see some good evidence emerging that changes in the relative prices of healthy and unhealthy products really do lead to changes in weight outcomes. And again, we're seeing it most in the most responsive populations, the populations we'd expect to be most responsive. So lower income, less educated, younger populations respond more to price. And then consistent with some of the literature on the economics of addiction, we see that it's the heavier consumers that are actually the ones that are responding more to price in the long run. So the populations that consume the most, that are at greatest risk for obesity, are the ones that are responding more to changes in price. The other thing we've done in this area is to consider the idea of subsidies. I think this won't surprise economists, but it surprises a lot of public health people. But the idea here is that subsidies by themselves are not going to be very effective in dealing with obesity. So the subsidies are effective in raising the consumption of the subsidized products. So we've seen efforts to subsidize things like fruit and vegetable consumption. That increases their consumption. But that produces an income effect at the same time, gives people more money, and they spend that, not surprisingly, on unhealthy things as well as healthy things. And what we're generally seeing with the subsidies is a net increase in caloric intake. So targeted subsidies may make sense to deal with some of the issues around regressivity of these taxes on these types of products, but general subsidies are probably going to be counterproductive. So all that's led us to doing work on sugar-sweetened beverage taxes. We're starting in this area because of the fact that these products have a clear link to obesity. There's a number of other health consequences associated with them. They're products that provide no nutritional value. And there is some growing evidence that sugar itself can be addictive in some ways, at least to some populations. So just again, looking at some of the evidence, if we look around the world, we see that the countries where there's high sugar-sweetened beverage consumption are countries that have high rates of obesity. We've seen sugary drinks becoming very, very affordable in most countries. Almost every country in the world has seen products become more affordable relative to incomes. We started doing work on this issue in the US. In the US, we thought we would take advantage of the fact that there were differences in sales tax rates across US states. But the problem with looking at these taxes were that they weren't comprehensive taxes. They didn't tax all the sugary drinks. They weren't taxing specifically the sugary beverages. They would tax, for example, all carbonated beverages, diet beverages, sugar-containing beverages. They wouldn't tax other ones. So what we started to see was some limited evidence that these taxes could have some impact, but because they weren't very specific, because they weren't very comprehensive, we didn't see major effects. Where we have seen the evidence, I've been involved in some evaluations in Mexico where they were the first country to adopt a significant sugary beverage tax. Here we saw a tax of 1 peso per liter go into effect several years ago. That led to about a 10% increase in price. And what we're seeing is very good evidence that this is impacting consumption. So this is some data looking at what the impact has been on sales of sugary beverages. They've basically gone down and flattened out over time relative to what they would have done if they continued on the trends that they were on. So we're estimating about an 11% drop in the most recent data, 2016. And again, substitution towards less unhealthy, more healthy, untaxed beverages like bottled water. Again, we've seen bigger impacts in lower income populations. So this is just looking at the impact on purchases in households in income tertiles. Biggest reductions in the lowest income populations, smaller reductions in the highest income populations. And then again, this idea that this is consistent with addiction, the idea that the heavier consumers are going to be the ones that in the end have the biggest incentives to respond because they're consuming more, because they're spending more of their budgets on these products. So here we've seen, again, significant evidence that it's the heavier consumers that respond the most to these products. All right, so we have all this evidence from around the world, particularly when it comes to tobacco, more so when it comes to alcohol, and starting to emerge when it comes to sugary beverages. But when we look around the world, we see that governments are really not using economic tools, taxes in particular, to try to change the consumption of these products. If we look at cigarette taxes, we see that most of the countries in the world do not reach the WHO's target, which is taxes that account for at least 75% of price, or excise taxes accounting for 70% of price. When it comes to alcohol, we see a lot of governments that don't even tax all alcoholic beverages. They may tax things like distilled spirits, but they don't tax wine or they don't tax beer, and partly because of the local alcohol industry, some of the products are exempted. And then when it comes to the sugary drink taxes, we are starting to see some growth in this area, still relatively low taxes, but they are starting to emerge and there's starting to be more interest in these taxes in different countries. And I think the reason that we don't see as much progress in this area as we might is because of some of the economic arguments that get used against these taxes. So there are some common economic arguments that you see across all these different products. One is that they're not going to have their public health impact. They're not going to reduce use and consequences of use. But there, I think the evidence that I just showed you is really clear that they do. The second one is that they're going to lead to extensive tax avoidance and tax evasion. Third, that they're going to harm poor consumers the most at their regressive taxes. And last, that they're going to lead to massive job losses, have significant negative macroeconomic effects. Again, if we look at the evidence on these issues, most of it comes from tobacco, but I think the evidence is pretty clear. When we look at tax avoidance and tax evasion, we see a few basic things. We see even when there is tax avoidance and tax evasion, increases in taxes, increases in prices do lead to real reductions in tobacco use. This is a picture from New York City. Taxes there are second highest in the country because of increases in state and local taxes. And what we've seen is that even though about half the cigarettes consumed in New York avoid or evade taxes, we've still seen real reductions in smoking among young people and adults. They also generate revenues even with tax avoidance and tax evasion. So these are some data from Chicago, where I come from, looking at what's happened at the local level to tax revenues. About 2/3 of cigarettes in Chicago avoid or evade taxes, but even as those local taxes have gone up with that tax avoidance and tax evasion, we've still seen increases in revenues. And then when we look around the world, we see that it's the opposite of what you'd expect if it was tax and price driving illicit trade. So what we're looking at here is on the vertical axis, the market share for illegal cigarettes as a function of tax and price levels. And what we see is the countries that have high taxes, high prices actually have less of a problem with illicit trade, and countries with lower taxes and prices have more of a problem. And that's because tax avoidance, tax evasion are really driven by strength of governance, much more so than tax and price levels. So I actually just reviewed a really nice dissertation that went through and looked at all these different issues and how they relate to tax evasion at the country level relative to tax and price levels. And again, very consistent. These measures of governance are really the ones that drive illicit trade. This is looking at the same market share for illicit product as a function of transparency now, or the freedom from corruption. And here we see countries that have a lot of corruption on the left side, more illicit trade. Countries that have little corruption, less of a problem with illicit trade. And then the last point to make here is that if governments want to do something about illicit trade, they do have very effective tools that they can use. So this is a picture from the UK. If we go back to the early 2000s, illicit cigarettes accounted for as much as 28% of consumption in the UK. But what they decided to do was really make dealing with illicit cigarettes a priority, strengthened their enforcement efforts, adopted some new technologies, strengthened the penalties on people that were engaged in smuggling cigarettes. And they were able to reduce the size of the illicit market, less than 10% currently, at the same time as they were able to raise their taxes and generate new revenues from those taxes. So a lot of those principles are incorporated into the illicit trade protocol to the WHO's Framework Convention on Tobacco Control, the first global public health treaty. So this is something that recently came into force, really deals with a lot of the issues around tax administration, enforcement, penalties, and the importance of cooperation across different sectors. And when these sorts of principles are applied, we do see effective work against illicit trade. When it comes to the beverage side, we see virtually no evidence on illicit trade when it comes to alcoholic beverages. And no evidence when it comes to those sugar-sweetened beverages. We are starting to do a little bit of work on this in the U.S., trying to look at cross-border shopping, for example, in response to differences in state tax rates. It's something that the evidence really needs to be developed on. The second big argument was the idea that these taxes are regressive taxes. They're going to hurt the poor. When it comes to tobacco, we've seen some good evidence emerge over time showing how tobacco use causes poverty, how it diverts spending from necessities to tobacco products, how it leads to the lost income as a result of missing time at work when people get sick with diseases caused by tobacco, and then how you see premature deaths and the loss of income associated with that. So it's not so much that raising tobacco taxes would increase poverty as much as it is the other way around. Tobacco use causes poverty. The other thing we know is that low-income populations respond the most to these taxes, so that when you raise taxes, raise prices, you see biggest reductions in use in the lowest income populations. These are some data from Turkey looking at who bears the burden of a tax increase and where the reductions in consumption occur. And what we see is that the burden of the tax increase is really borne by the higher income consumers who continue to consume, while the lowest income groups significantly reduce their consumption. And then some really nice work over the last few years coming out of the World Bank that looks at the longer term implications for tax increases, taking into account not just the reductions in consumption, but also then looking at what happens to healthcare spending over the life cycle, what happens to incomes. And when you factor in the reductions in healthcare spending, the increases in incomes, it turns out that increasing taxes on tobacco products is a very progressive policy. And then the last point here is just that how the revenues get used is also going to be very important. If those revenues get used for programs that are progressive, that's going to minimize any negative financial impact on low-income households. And I think the best example of that recently is what's happened in the Philippines. In 2012, there was a significant cigarette tax reform in the Philippines, significant increases in taxes, and then 85% of the new revenues from those tax increases were put into their universal health care programs, significantly increasing the amount of revenue specifically targeting the poor. And then the last argument is the one that it's somehow, if you raise these taxes, they're going to have a harmful effect on the economy. The industry talks about the idea if you raise taxes, reduce consumption, people that work in that sector are going to be put out of work. That's going to lead to reductions in tobacco farmers, tobacco manufacturing jobs, and then those work their way through the economy. They affect the distribution chain, they affect the retailing, and then there's a multiplier effect as people lose incomes from those jobs that works its way through the economy. What they don't talk about is what happens on the other side if consumers don't spend the money that they were spending on tobacco, if they spend it on something else. That's going to create jobs in other sectors. Governments are going to spend the tax revenues on things that tend to be very labor intensive, creating more jobs. And what you end up seeing is offsetting job gains in other sectors. We've seen a lot of work in this area on tobacco. It's all summarized in the monograph that I talk about, where we see these net positive effects on jobs in almost every country. And then to some extent, if there are concerns about these transitions happening, some governments have taken some of their tax revenues, put them back into crop substitution programs, retraining programs, to help people employed in those areas transition to other livelihoods. Same sort of evidence starting to emerge. We've got 2 studies on sugar-sweetened beverages and 1 study for alcohol at this point. It's really nice evidence looking at the experiences in Mexico, showing that as the taxes were implemented on sugary beverages, no significant effects on employment in the beverage industry, partly because people substitute to other products that are being produced by the same companies, no impact in the retail sector, and no impact overall. We did a similar study looking at what would happen in some US states if sugary drink taxes were implemented, and again, found generally this sort of small net positive effect. And then most recently just published a study looking at this when it comes to alcohol taxes. And again, no evidence of a negative effect, if anything, a small positive increase in employment in response to increases in taxes. So to summarize all this, I think it's clear. The evidence that's emerged over the last few decades clearly shows that the demand for addictive products, other unhealthy products, is responsive to changes in the prices of these products and in the other costs of consuming. And that's where taxes, I think, can be particularly powerful, very powerful economic tool for changing demand for these unhealthy products, reducing use, and ultimately reducing the health and economic consequences. And when we think about the counter-arguments that I talked about, the evidence, again, I think is fairly clear that you do not see these effects in most places. Where you do see some effects, the arguments against are greatly exaggerated. So we've talked a little bit about some of the priorities for where this research needs to go. There's a lot of evidence in high-income countries, less in low and middle-income countries. So a lot of the efforts that we're engaged in are really to try to stimulate work in this area in low-income countries, middle-income countries, looking at how tax and price affects demand, looking at some of the economic consequences or perceptions of economic consequences from tax and other control policies, and dealing with things like the issues around poverty. So we're doing this work as part of a bigger initiative that's supported by the Bloomberg Philanthropies. They've been working on tobacco control policies, trying to get evidence-based policies implemented in countries for the last 12 years. 2 years ago, they brought our team in from UIC to really try to build the evidence base on the economic policy side in some of their priority countries. So here we're really trying to work with think tanks in some of the high priority countries, high burden countries, to develop this evidence and then to communicate this evidence to policymakers. So currently we're working in, I think, 17 countries around the world, 22 different partners. And we're fortunate to be working here in Pakistan with two really great organizations, the Pakistan Institute for Development Economics and the Social Policy and Development Center. So part of what's exciting to me is that at the end of this session, they're going to release a couple of reports that they've produced because of the work that we've been helping with over the last year. And then tomorrow morning, for everybody that's interested, come back at 9 o'clock and we'll have a much more in-depth discussion of those reports. Thank you.
Thank you very much, Professor Frank, for your very enlightening and informative talk on this subject. I think we'll have our discussion question and answer session at the end of this session. Our next speaker is Professor Roberto Iglesias, who's a Technical Officer, Prevention of Non-Communicable Diseases, WHO Geneva. This non-communicable disease is one of the subjects which is very neglected in Pakistan. We haven't taken any action so far in Pakistan. Please.
First of all, I would like to thank the organizer for this opportunity to comment Professor Chaloupka's lecture. I have to say that I was formed in tobacco taxation, reading and learning from Professor Chaloupka articles, chapters, and books organized by him and his colleagues. And I strongly recommend for anyone willing to understand the problems of tobacco economics and tobacco control economics to read the Tobacco Control Economics in Developing Countries. It's a classic now in the literature on tobacco control economics and tobacco taxation. You can find, because I normally when I work with a person in tobacco control and the person is new, I normally give as a present this book. You can purchase in the internet or you can download in the chapters from the World Bank. I'm doing a kind of advertisement, but in fact, my experience was to read the whole book and then to go through the articles, but there you will find a good piece, and there are other things that Professor Chaloupka has done. But let me just to mention that he and Professor Pravatjat were behind the book, The Tobacco Control Economics in Developing Countries, and the research hosted by the World Bank at the end of the last century. The book and the World Bank flagship, Curbing the Epidemic, which are mentioned in Frank Chaloupka's presentations, are two milestones in tobacco economics and help the approval of the Framework Convention for Tobacco Control. More recently, Professor Chaloupka was also behind the WHO Technical Manual on Tax Administration and the joint publication of the National Health Institute of the US and WHO in the Economics of Tobacco and Tobacco Control. So all who have studied these problems and read this literature where Frank Chaloupka's contribution is fundamental, agree with his conclusions, in fact are our conclusions, that tax and other policies targeting demand for addictive and unhealthy products are effective in reducing use and related health and economic consequences, because demand for addictive products respond to change in monetary prices and other costs of consuming. So sustainable real price increase, particularly overcoming the growth of income to reduce affordability, and sustainable increases of other costs of consuming, this idea of full price of Professor Chaloupka, and I think it's a nice term to include other tobacco control policies like pictorial warnings and smoke-free places, drop the prevalence of the use and the intensity of consumption of addictive products. So prices work. And of course, we all agree with his third conclusion. Counter-arguments about negative economic impact of taxes and other control policies are false or greatly overstated. However, tax authorities in many lower and middle income countries believe or have the understanding that negative economic impacts could be important. So the taxing, for them, the taxing of these products over normal levels that his or her society has the understanding, his or her society taxes these products, could be dangerous and could lead to undesirable outcomes. So the point is that we agree that the industry, the stakeholders defending the consumption of these unhealthy products overstate, and sometimes they produce false arguments. But the point is that tax authorities believe or have the understanding that negative economic impacts could exist. So I think that one important point is that research should be addressed to counter-argue those fears and concerns of the tax authorities. Okay? So I agree with his list of research priority. At the end of the presentation, he displayed the list of research priorities, but I would like to add two topics, and I think that they are important. One is to put more emphasis on measuring the size of illicit tobacco trade in the country and improving the understanding of the nature of the illicit trade or tax evasion in a country. First of all, because the industry is playing with the size of the illicit trade. So one way to demolish the argument is to show alternative numbers about the size of the illicit trade. Secondly, I will insist in research on the characteristics, on the nature of the illicit trade, because it's a multidimensional problem formed or composed by institutional weakness, legal loopholes, conflict, and unsettled things between the federal and the provincial level, and corruption. Yeah? And we need to know and to discuss and to put in the policy agenda what is necessary to reduce corruption in a country. Although we are talking about a small point, but we need to contribute to the policy agenda with some ideas about where the corruption is and how we are going to reduce or to contribute to reduce the level of corruption. So for me, tobacco control economics should do more to understand the mechanisms of corruption operating in the tobacco business and in the relation of the tobacco companies and the regulatory authorities. This could help to understand better the general situation of corruption in a country, and we could contribute, although we know that corruption is not only a problem of tax evasion and custom administration, but somehow we have to highlight the tobacco taxation and tobacco control as a pilot case to reduce corruption. I think that the other point that we have not researched in a sufficient manner is the question of tax and custom administration. This is an important point of concern. Domestic tax evasion and smuggling always have a central component of tax administration and custom administration weakness. And I thinking today about this problem, I think that there are several ways to attack the weakness on tax administration and custom administration. One is in the Professor Chaloupka lecture, is the Illicit Trade Protocol. Pakistan has ratified and is part of the parties of the Illicit Trade Protocol. As is an important instrument because it's basically the Illicit Trade Protocol has several components, but has a big component of improving tax administration. And for that, I think that we working in tobacco control economics, we need to build knowledge about how to implement this protocol to bring the experience of developing countries and to try to develop the knowledge in developing countries, because this will improve tax administration in tobacco sector, and I will say more, this will improve tobacco tax administration in the country. So a country implementing the Illicit Trade Protocol will be better in terms of tax administration after the implementation. And the last point that I thought this afternoon is that I think that we have to seek the cooperation of other international organizations like the World Bank and the IMF, which are now working on tax administration, to join forces to help to develop a better tax administration procedures in the tobacco sector, to help us to identify problems and to identify tools to improve the situation of tax administration. As in the corruption case, I think that the tobacco case could be a pilot experience for improving tax administration. As a summary, I would say we have the knowledge why tobacco is harmful, and we know that taxation is working, and in this knowledge, Professor Chaloupka has a great contribution, a fundamental contribution, and we need to reduce the fears and the concerns of tax authorities, and for this reason we have to raise the information and the knowledge and the analysis. But I think that I would like to add that there are 2 points that we have to put the efforts, And we from WHO we are working on these issues jointly with Professor Chaloupka and the University of Illinois in an effort to improve tobacco taxation in lower and middle income countries. Thank you.
Thank you, Dr. Roberto Eliasis, for your sharing your thoughts with us and sharing your experience in WHO with us. Our next speaker would be Dr. Muhammad Idris, who is Assistant Professor of Economics in Quaid-e-Azam University, Islamabad.
Thanks to Professor Frank Chaloupka for his comprehensive talk on economics of addiction. So it was really a value added for us. This is relatively a new research area, especially in countries like Pakistan. It's of great significance, where a significant proportion of population is addicted to drugs, specifically if we just focus on smoking and use of tobacco, then as per rough estimates, about 1/3 of the male adult population use tobacco, and about 6% female use tobacco in Pakistan. So this is a significant number, which makes the sense that economics of addiction has a great relevance for a country like Pakistan. In his presentation, Dr. Frank presented the different models of estimating the demand function for tobacco. The models were very interesting, and he rightly pointed out that the standard demand functions cannot work out, cannot be used here, because the demand for tobacco and such other addictive products, they have the intertemporal interdependence, due to which the traditional model fails. He rightly pointed out the rational additive model. And moreover, whenever we talk about a consumer who use the tobacco products, who use the addictive products, for him, that particular product is in fact something very close to the essential product. He just treats it as an essential product. So if he's going to make the plan of his if he's going to make his consumption plan, then he treats that particular commodity as a necessity. So the ordinary models do not consider these things. And what I feel is that there could be a very comprehensive study with reference to Pakistan, incorporating all the factors which are pointed out by Dr. Frank, and then we should also incorporate that what are the reasons of addictions, and also the factor about the availability of the addictive products and the freedom to use, then to work out such a demand function can really give an insight of all this information. Regarding the impact of prices, market prices I'm talking about, he talked about full prices as well. Regarding the impact of market pricings on addictive behavior, the findings were very interesting. However, the analysis which were presented by Professor Frank, he merely focused on the aggregates. So we can have a more insight if instead of focusing on the aggregate, we focus on the different income groups, that how different income groups behave due to the change in price. I can claim that the people who are sitting in this hall, even if the price of cigarette doubles, they will not reduce their consumption. So it's the income group which is very important in this regard. And regarding Pakistan, I would like to say that the increase in price of tobacco or cigarette, whatsoever is the case, will not be so much effective in reducing the consumption of tobacco. The reason being very simple. If we just look at the statistics reported in Household Integrated Economic Survey, then about 1% of the average total household expenditure goes on tobacco. So it means that we are already spending a very insignificant proportion of our total expenditure on the use of, on the consumption of tobacco. So if only 1% of the average household consumption expenditures are going on a particular commodity, then the price change of that commodity will not really affect the consumption patterns. However, it was one more thing I would like to point out, that over time, what is happening in Pakistan is that the share of expenditure on such products, especially the tobacco, is decreasing over time. It is 1% now. 15 years back, it was about 2%. So this again is a very interesting finding. Regarding taxation, government of Pakistan has also worked on tax increase, which is likely to have, I think it's my personal opinion, that the taxation policy of government is likely to have a positive revenue effect, but insignificant consumption effect. So this was my view on this paper. I'm really thankful to the organizers of this workshop. Thank you very much.
So I think now we go for question and answer session, and there are a few questions with me. If there are more questions from the audience, we can take those questions for every speaker. The first question is for Dr. Idris. People are already poor. Increasing taxes and low elasticity would lead to a disaster. And then a question for Roberto. What about the political economy? Taxing leads to distortion, means job losses. And what about consumer independence? The question is, Dr. These people are already poor, and increasing taxes and low elasticity would lead to a disaster.
In context of tobacco consumption or overall? It's
tobacco consumption and taxes on the tobacco.
Actually, what I feel is that whenever the taxes are imposed on tobacco consumption, I think it will not affect the poor class. Because poor class usually takes those brands which are already low priced, and whenever the taxes are imposed, the focus is on high brands of cigarette. And secondly, especially in rural areas of Pakistan, where the poor class is addicted, and the poor class used to take smoking or tobacco, whatever is the case, they don't actually pay for it. They get it against their, sometimes they get it against their services. For example, if someone is working in a factory and he's a poor, then it's his owner may give him some cigarette or something like that against his services. So taxes, I think, are not going to affect the poor class to that extent.
Can I just add a couple of comments on that? I think the opposite is actually true in Pakistan. So we'll have I think a much more elaborated discussion tomorrow, where the Pakistan Institute for Development Economics is going to present some of the work that they've been doing over the last year. They have worked with those household expenditure surveys to look at how much of household budget shares go to tobacco. And it is actually fairly considerable. It's as much as 3.5% on average across Pakistan, more in some parts of the country than in others. And then part of what they've done is to look at actually estimating price elasticity of demand for tobacco products. And what they're finding is that in Pakistan, if anything, demand is more responsive to price than it is in many other countries around the world. So tax increases can be very effective. And then I think one of the really key points is that they've shown that low-income households are the ones that are most price responsive. So that's where you're going to have the biggest impact on poverty. And then I think getting to the point that you were asking about how that could be a disaster for the poor, I think what actually happens is the other way around. Because their consumption reduces so much, they're going to be the ones that benefit the most in terms of reduced expenditures, in terms of improvements in health. And then again, greater incomes, less spending on health over the long run, as we're starting to see in country after country around the world.
Thank you.
In fact, the political economy varies from country to country. Yes. Oh. Yes. No, it's working. So I think that Professor Chaloupka put nicely the main arguments of the political economy. So the reasons alleged by the industry why you should not increase taxes, and in fact most of the time these arguments are completely out of the tone, out of the dimension of the situation, out of the dimension of the impacts, of the real impacts and the likely impacts on the economy, on the poor, on the jobs, on the revenues. And I think that, but as I said, because these are arguments that tax authorities really believe and they consider because of different reasons that they are good arguments, we need to develop research, analysis, and build information to discuss these arguments. But from my point of view, the most real argument, the most important argument is the argument of the tax administration and the possibility of illicit trade. So we have to analyze the situation, and normally there is no correlation between tax increase and smuggling. Smuggling exists even with lower taxation because it's related to other factors.
Yeah, thank you very much. Thank you. So what about distortion and means of job losses? Thus, I don't think we will be that much a factor as far as Pakistan is concerned. What about the situation in the United States of America?
So there's been a number of studies that have looked at the job losses that relate to tobacco control policies. And what we generally see is that the job losses are relatively small. They're something that happens over time. And in many cases, a lot of the job losses that we've seen with tobacco are really driven by the changes in the industry, not because of tobacco control policies. So as the industries become more globalized, as they concentrated their production in fewer and fewer places, as they've adopted more capital-intensive technologies, we've seen jobs going down because of that, and relatively few jobs lost because of tobacco control measures. And then, as I said earlier, what we see is this offsetting benefits in terms of if consumers don't consume tobacco, spending money on other products, government spending new tax revenues, and that creates jobs in other sectors that do lead to job gains that more than offset any losses. So it's really nice that these questions are coming up because our other partner in Pakistan, the Social Policy and Development Center, is releasing their report tonight. And one of the things that they focus on is exactly that issue, the economic contribution of tobacco in Pakistan and what would happen to jobs if there were to be increases in taxes. And what they find is that the tax increases would be very good for the local economy. So you'll hear much more about that in a few minutes when we're done with this, and they release that, and then a lot more tomorrow morning.
Great, thank you. And what about the consumers' independence?
What do you mean by consumers' independence? I mean, consumers, I mean, that's...
He wants to use the tobacco and you put a tax on that.
No, I mean, what we need to come back to is the whole idea of market failures. So I think, again, the economists in the room recognize that when it comes to tobacco, we have several key market failures. We have the fact that consumers really don't fully appreciate addiction. They don't fully appreciate the long-term health consequences. So you have these information failures in the markets and really asymmetric information in the sense that the industry knows a lot more about that than the consumers do. And then the second part of it is that you have the externalities that go along with it. You have the non-smokers who are harmed by exposure to tobacco smoke. And then you have in countries where at least some of the healthcare is financed publicly, you have financial externalities as non-smokers are subsidizing the health care costs for smokers. So I think it's those market failures that really drive economic interventions, particularly taxes in these markets, as a way to just make sure that if somebody is consuming, they're fully informed and they're paying the full costs of their behavior. So I don't think, from an economics perspective, I don't think the optimal level of consumption is zero, but I think what it does require is a significant intervention in the market to raise prices, impose other policies to deal with those market failures.
So now we come to the launch of the reports. I would request the SPDC to come to the stage and present the report to the chair and other members of the panel. The title of the report is The Macroeconomic Impacts of Tobacco Use in Pakistan. Now I'd request PIDE to come on stage and present the report to the chair and other members of the panel. The title of the report is The Economics of Tobacco Taxation and Consumption in Pakistan. So now I would request the chair to quickly wrap up the session with his concluding remarks. Thank you.
Thank you very much. I think I'm a doctor, I'm a cardiologist, so whatever way you can stop the smoking, is good for your health. And as far as I'm concerned, I daily see people dying like flies in our hospital. People in their 20s, their 30s, and 40s and 50s coming with a heart attack and dying right in front of our eyes. And 1/3 of those patients are smokers. So it has to be stopped. People have to be educated whatever way you can, whether it's taxes or whether you can educate the people, or you can, I think, put the legislation into enforcement. That's a really very important thing. Not only that, the patients who are afflicted with the disease, you treat them in the coronary care unit, and you educate them and hammer them with the advice, please don't smoke. And after 4 or 6 weeks, they'll come back again, smoking again. They may stop it for a week or 2 or 4 weeks, but come back again with a restart of smoking and having another attack. You put in a stent, spend 2 lakh or 3 lakhs on them, do a bypass surgery and spend 2 or 3 lakhs on them, and then after a few months, once they're asymptomatic, they're comfortable, they restart smoking. So something needs to be done. As far as the addictive taxes are concerned, that is the best way. I think most of the our patients, who smoke, they belong to poor class and less educated class. And once you increase the tax and make it expensive, maybe that stops them from buying the cigarettes and then quitting the smoking. I think this increased the poverty as far as the this impact, the social impact of this menace is concerned. It's a great menace. I think if we have some kind of action plan on the non-communicable diseases where we are spending more on tertiary care hospital, we are spending more on treatments than on the prevention. The prevention is our solution. The kind of a burden of this disease is here in Pakistan, this part of the world. The 80% of the burden of this disease in the whole world is in this part of the world. So, and 80% of the patients, they die from heart attacks in this part of the world. And the only way forward is prevention. I think I don't know anything about the economics, but as far as my subject is concerned, cardiology, I think this has to be stopped, and we have to educate our masses and our population so that we can have more health-related benefits by stopping this smoking. I would wrap up this thing and my speech here, and thank you very much for inviting me for the organizing committee administration as a chair, co-chair, and this is the kind of input I can have. Thank you very much.
Now I would request the chair, Dr. Kiani, to please present a shield as a token of our appreciation to the speaker, Professor Chaloupka. I would request Dr. Iglesias to please come forward to receive your shield. Dr. Idris, kindly come forward to receive your shield. And lastly, I would request Dr. Asad Zaman, VC PIDE, to please come on stage and hand over the shield to the Honorable Chairperson, Dr. Kayan. Thank you very much, everyone. With this, we come to the end of this session.